Good. Testing, testing, testing. All right. Thank you, everybody. Apologize for the brief delay there. We're having a few audio issues, which are not uncommon. We'd like to welcome you to Living Well with Adena. We thank you for repeat visitors and for folks that are new with us today. We've been doing this every few weeks to keep in touch with our community and provide you guys information and updates. We've been living here with the coronavirus I want to start with an introduction. I'm Kirk Tucker. I'm an internal medicine physician and Chief Clinical Officer here at the health system. With me today is Amy Robertson, the Director of Quality and Infection Prevention. So she and I have been working very closely together over the last 4 months in the efforts surrounding coronavirus. We all have been living with coronavirus now in our communities for nearly 5 months. Our efforts in Ohio to flatten the curve this spring made Ohio a poster child for the country. People were following stay-at-home orders. We were careful to observe the safety guidelines related to hand hygiene, social distancing, and the use of masking and face coverings. Unfortunately, as things began to open up and summer arrived, we became less diligent in our protection measures, and in some cases, people have been downright defiant. It's been a long, difficult time, and as with human nature, we get bored and we're ready to move on with our lives and get back to normal, and I can certainly sympathize. Now we're seeing the effects of that complacency. The numbers of COVID-19 positive cases are reaching higher levels than we saw in the spring of this year. Our COVID-19 cohort unit has as many and some days more than we did at the beginning of the pandemic. The hospital staff is beginning to experience burnout, but our healthcare heroes continue to fight this battle and to protect the patients, survive and recover. Today we're going to take a close look at the current data, and we're going to talk about why it's important to wear a mask to reduce this serious uptick in cases here locally and statewide. As I mentioned, Amy Robertson is with me today. We had originally hoped for Dr. Brown, the lead physician at the County Health Department, to be with us, and he might be joining us here in a little bit. We will add him if he arrives. I want to update everybody on the current situation. Let's kind of take a look at the local data. Earlier this month, Governor Dewine unveiled a new system for measuring the dangers of the coronavirus in Ohio and identifying hotspots by county. At this point in time, we have over 60,000 cases in the state of Ohio. That's to date, have it and recovered and active cases. And we have over 3,000 deaths of citizens in Ohio. Counties designated under the governor's new system, counties designated red level 3 represent a public health emergency, and people there are required to wear a mask in public to reduce the spread of the infection. These generally at this point in time are bigger cities like Cleveland, Columbus, Cincinnati, Dayton. Last week, Pickaway County then was added to this list. Current data in Ross County indicates that about 185 total positive tests of over 5,000 that Adena has run itself have been positive. 150 or so of those have been Ross County residents. To date, we've had 3 deaths in people that live here in Ross County, and it's possible here in the next week that will be going up to 4. Let's focus a little bit more closely on a discussion of masks and the importance of the mask as the fundamental effort to reduce the spread of this infection. The coronavirus, as evidenced by the numbers I just gave you all, is obviously still here. At Adena, we have instituted safety measures in our hospitals, health centers, and clinics, and limited the number of people in our facilities that can come here to visit. There are screening processes for everybody entering the facility, and that includes all employees, which involves a series of questions and temperature checks. More hand hygiene stations are located throughout the buildings, and we've taken efforts in our offices, waiting areas, and public spaces to allow for social distancing, as many of you who might have visited here recently have noticed. Masks are currently mandatory for all staff and visitors of the campus. Today we are focusing on this concept of universal masking as a tool to reduce the spread of coronavirus. As I introduced earlier, Amy is here as the Director of Quality and Infection Prevention. Amy, can you give us an idea of why masks are recommended in reducing the spread of the coronavirus?
Sure. So as we learn more about this new novel virus, we know that COVID-19 is spread mainly from person to person through aerosolization or droplets in the air that we take for granted, that things that we do every day, like cough, speak, sing, anything like that. So if you're infected with the virus and you do these things, it goes out into the air and you could possibly contaminate another person. So knowing the CDC recommends using cloth face coverings for anyone in the public setting to reduce the spread of COVID-19. The cloth mask keeps the wearer from spreading the virus to others directly or indirectly, which can go onto surfaces, be touched, and then transmitted in that way as well. What we call this is source control. We're controlling the source of the possible contamination with the mask.
Excellent. What would you say to somebody who says they feel fine, so they obviously don't need a mask?
So again, as we learn more and more about COVID-19, we know that transmission can take place with asymptomatic and pre-symptomatic people. That means you can be infected and have no symptoms whatsoever and still transmit the virus to others. So it's very important that we wear our mask whether we feel sick or we don't.
And I am a firm believer in both sides of that. I wear a mask personally everywhere I go outside of my house once I leave my car, because I do truly believe that if somebody that has this virus is in a store, sneezes or coughs, and that virus floats into the air and aerosolizes and can be there for hours, that if I'm wearing a mask, I'm protecting myself from the infection and then my family and my mother and father, who are both still alive but high risk. So. Amy, help us understand the difference between mask and face covering.
Sure. So cloth masks or face coverings recommended for public setting, like I said, will provide source control. They don't necessarily provide any kind of coverage for splashes or sprays. So those kinds of masks are face masks and respirators that are used commonly in the healthcare setting, so that we have that added protection for those healthcare workers who might be working very closely with a patient just to maintain their care and their treatment.
All right. There is a proper way, if you can believe it or not, to take on and remove a mask and store it. In healthcare, we call this donning and doffing, but it's really very simple, and there's actually official ways that you should go about doing that. Amy, in the best way you can here in this room with the limited space and the need for masking, can you help us to understand how this is best done?
Sure. We'll try to keep this simple. You can look on CDC. It's a great resource for you. But for cloth masks, what you can do is you want to untie the straps. Always wash your hands first, especially when you're putting on the mask or taking the mask off. Wash your hands, untie or pull the ear loops, and then you can pull it forward away from your face, trying not to touch your face, because you want to, it's a good rule of thumb, to consider the front of the face mask contaminated. So if you're going to reuse this, so I'm just taking it off for a break or something within a healthcare setting, I can store this in a clean bag or a plastic container. If I'm going to throw it away because it's visibly soiled or it's hard to breathe through or anything like that, I'm going to go ahead and put it in a waste receptacle. And then if it's a cloth mask, of course, if it's visibly soiled, you're going to want to launder that in your regular laundry. So just making sure that we don't touch the front of the mask, I think, is one of the important points that we can use today.
As you guys have probably noticed, I've been doing the whole time as you speak with a mask on. It slides up and down.
It really
God
does.
forbid you're chewing gum. But yes, so this is the reason that hand hygiene, along with mask compliance, is so important. Because as I do this, the next thing I should be doing as I leave this chair to move about the room would be to use the alcohol sanitizer or wash my hands with soap and water. The Health District, in collaboration with the City of Chillicothe and Adena and several community organizations, have recently launched a mask campaign to encourage and educate the public on wearing masks. The mask initiative is basically where we're making free masks available to the public. At this point, masks will be available on a first-come, first-served basis, starting on Thursday, July 9th at the following locations: Chillicothe and Ross County Public Library, the main library on Paint Street, the Northside Library on Buckeye Street. The hours for the libraries are Monday, 9 a.m. to noon, Tuesday, 3 to 6 p.m., Wednesday, noon to 3, Thursday, 3 to 6, Friday, noon to 3, and Saturday, 9 a.m. to noon. They will also be available at Ross County Community Action up on the hill, 250 Woodbridge Drive, Monday through Friday, 8 to 4 p.m. So excellent place to go there during the week. And the United Way of Ross County on 69 East Water Street here in town, Monday through Thursday, 9 a.m. to 5 p.m. So if you need access to masks, more official type surgical masks, if you feel safer in those, you can go to these locations and get access to those. Cloth face coverings are considered acceptable if you have limited access to anything else. So if you have access to family members who have manufactured masking, anything that covers the face, the nose adequately and allows air to pass to a limited degree can be helpful in reducing the spread of the infection. Now, sort of some interesting questions. We were hoping Dr. Brown would be here to help us with that, but one of these is conspiracy theories and rumors are abounding, and wondering about the fact that in some people's minds, can a mask actually make us sick? And I've heard various things about that, from rebreathing air to breathing carbon dioxide. This is simply not true. I can introduce you to any number of my surgical colleagues, some of whom are in an operating room for up to 6 to 8 hours at a time, wearing a mask, face shields, and breathing the same air over and over, and performing one of the most complicated and intensive tasks as performing surgery. They're not toxic with carbon dioxide, and certainly we would not want to make them ill. So there's really very little reason not to wear a mask. I completely understand the folks that have anxiety associated with facial coverings, and in that limited case, I can understand that if you literally put on a mask and then start going into signs of a panic attack, clearly wearing a mask is a problem for you. The alternatives are obviously to send other folks out into the community to help pick up the things that you need, but trying to make yourself as stay at home as possible until we're safely through this. Some people with chronic medical problems like asthma and COPD, certainly if you are oxygen dependent and even while seated are partially short of breath, I could potentially see the argument of why a mask would make it feel like it was harder for you to breathe. But I take care of over 1,000 patients, and this is, I can count the number who meet this condition on one hand. Amy, some people have a legitimate health issue that makes it hard for them to wear a mask or face covering, as I just mentioned. What do you think? Do you have any other suggestions as far as what those people can do to be able to protect themselves and others?
Yeah, and just to add to your list of people who may not be able to wear a mask, it is not recommended per CDC for face coverings for children that are 2 and under, just because, or anybody trouble breathing, incapacitated anyway, because the safety outweighs the benefit there. Mm-hmm. So in these cases, social distancing and limiting any interactions is even more important. Instead, you could use cough etiquette, coughing into your elbow, using tissues if you need to, throwing those away in a waste receptacle, and then proper hand hygiene afterwards. There are also alternatives to masks, like bandanas, some kind of looser things. Any kind of protection is better than none.
Excellent. Do you think, Amy, wearing a mask means that it's now safe to stand closer than 6 feet?
No, and I know this is a hard concept for people because I see it all the time, and I'm guilty myself, and I have to be reminded. So it's meant to be in combination. You want to use distancing, cleaning, masking, hand hygiene, all of those things combined together is just added protection for all of us. So we want to practice all of those things together.
And what do you think? Is it safe for children to wear masks? I noticed you talked about maybe 2 or 3 and under, but children older than that?
Yes, I believe it is, as long as it doesn't pose any kind of safety risk.
Excellent. Yeah, I've watched sometimes with a big smile on my face at our screening stations as somebody walks in with a 3-year-old and they try to mask them up, and they're just not having it. So, I think the message here is that we have to do the best that we all can as a collective or a group. And hopefully with that, all of us doing at least as good as we can get, that we make a difference in what happens here. We talked about testing, or we're going to talk about testing briefly. It is happening in our community. The folks here at the Adena lab, the urgent cares, and the COVID clinic have done an amazing job adapting to the things that I know that you're all hearing about, which is the extreme limitations on the ability to test. They've done that through standing up numerous platforms, basically different types of computers that run a COVID test, so that we're not beholden to any one reagent. We're actually making the swabs to collect the samples here at Adena, and we have over 5,000 of those swabs here today, self-made. But the reagents is our biggest concern. As of today, we use a combination of testing, some of which is on-site rapid testing. We get a result in 45 minutes. We use that for folks that come to our ER that appear extremely ill and need admitted to the hospital. In order to keep the other patients safe and the caregiver safe and to know whether or not you belong on the COVID unit, we run that rapid test. And if it's positive, you get placed in isolation, and a special care team tends to you with much more robust personal protective equipment. Some of the other testing we prioritize is on healthcare workers, people that might have been exposed and then are symptomatic, partially to return them to work potentially, and then also partially just to know whether or not we're dealing with a local outbreak or spread here on campus. Right now, testing is available to the public through any number of sources, certainly through your private doctor's office. I know that many of you might have experienced one of the new telehealth visits where your physician calls you on the telephone or visits with you on your computer in the video system. Your physician has the ability to order COVID testing now in that way, and you will be tested at one of the Adena lab or urgent care sites, many of which are drive-up, meaning you're not required to come into the building. If you have a physician's order, can drive up and they will be able to perform COVID testing there. Certainly our emergency department, if you're sick enough to be admitted, is performing COVID testing. We perform testing on the inpatient setting, and we now perform testing at all urgent cares. So if you don't have ready access to a physician or physician's office, if you present to one of the local urgent cares, that is Adena, we can test and run that there as well. If you have questions about COVID symptoms, again, remember the COVID hotline, 542-SAFE, area code 740-542-SAFE, which is 7233. They can give you guidance and next steps. I can tell you that here in the last week to 10 days, that line has gotten much more busy. This is another reason I know that this virus is now in our community. So please be patient with us. If you call that number and experience delays, call back maybe after 5 or 10 minutes. I do think you also have the ability to leave a message or speak to an operator. So we are going to be altering our staffing of that to ramp that up, anticipating that over the next 4 weeks, many more of you will be calling. Now, as many of you are used to with the Living Well sessions, we do questions. These questions have been submitted through the internet and the Facebook Live platform. And so Maria has graciously written those down for me, and we will kind of go through some of those. The first thing that I've got here is sharing our thoughts on Governor Dewine's message yesterday. As maybe many of you did, I anxiously awaited that message and logged on, and it appears the website was so busy I couldn't get in through my computer. My wife then figured out the streaming on her phone, so we were able to listen. The biggest concern that I have is specific to the picture that he was painting for us in the next 4 weeks. He compared and contrasted numbers where we're at today in Ohio with the numbers that were happening in Florida, Texas, Alabama, Arizona 4 weeks ago. And it's very clear that we are on a parallel course now with those states in the South for what could be a catastrophic epidemic. Many people think, well, I don't know anybody with coronavirus. I don't know anyone that's died from coronavirus. Is this thing even real, or is this a scam or a put-on? I take care of patients in this community. In the last week, I still see patients in the office. I've seen 2 folks personally affected by coronavirus. One with a death in her family here locally, was one of the 3 deaths, and the other of a family member that they had in Florida. It was my patient's daughter and her children. And she was terribly distraught that day in my office, worrying about what was going to happen with her kids and her grandchildren. So I think the governor did a good job of painting a picture, hopefully scaring many people into action. I think as many were, hoping that there would be more of some firm guidance and a mandate. You know, several cities and counties have the mandatory masking order. I sincerely believe, as not only a physician, but a scientist, and just somebody who reads a lot and looks at this kind of stuff, that there is no excuse right now with the numbers that we're seeing statewide for leaving our homes, leaving our cars, and going to a public place and not wearing a mask. There just simply is no excuse. The consequences of this could be catastrophic. I was scribbling down numbers yesterday. This type of virus, these coronaviruses, behave like influenza viruses. They're both what we call RNA viruses as opposed to what we're made of, which is DNA. These viruses, unmitigated, typically spread through 80% of a population if there's nothing done to mitigate their spread. It's not 100%, it's about 80%. There are 360 million people in the United States. If this virus spreads through 80% of that population and continues to demonstrate the same mortality, the death rate that it has over the last 4 months, which is a roughly 1%, we can expect upwards of 3 million deaths in the United States by the time this is all said and done. There are only 2 or 3 ways that doesn't happen. One is a vaccine, not only made, but proven effective, but then mass-produced and gotten out to enough of the population to stop the spread of the infection. And the other, which is much more realistic, is us all doing the right thing. Us all wearing a mask, us all looking at that family reunion party or the gathering on our block and saying, you know, this year I'm not doing it. I'm going to stay home. I'm going to let the folks that choose to do whatever enjoy their time. But I'm going to do the right thing this year. That was me this year on the 4th of July. It's one of my favorite holidays. I love the summer. I love to be outside. I love to be with people. We sat home. I hung out with my family of 5, and I listened to my neighbors shoot fireworks off all around the city. So I thought his message was dire enough, but I really was a little disappointed in the lack of a unified directive at the state level. Amy, you got to watch the message. What were your opinions?
I completely agree. I feel like it would be good to have some type of uniform mandate for the state, because as you're seeing, Sam's Club, Walmart, different places are mandating the masking if you're coming to their facilities at this time. So I think we're going to get there. But no mandate yet.
Yeah. And unfortunately, the way that these things work is you're generally there a little bit too late, is what happens. Yep. So it does require some educated guessing, and sometimes people are wrong. Part of the question here is a question about limits on large family gatherings. You know, I tell all of my patients before I walk out of the room, the masks work. So ignore anything they hear that say they don't, or it'll make them sick. I also tell them that the highest risk they can put themselves in is a large, crowded indoor space.
Agree.
As many of you might have heard, Walmart yesterday announced you can't enter a Walmart now without a mask.
Yes.
Very smart of them, because when you get a large number of people in a closed space where we're circulating the air over and over, I don't care how good the filters are, and one of those people is symptomatic and emitting the virus, spreading the virus when they sneeze or cough, that virus goes into the air, and unlike outside where it maybe blows away or the sun's UV light destroys it, it floats in the air, in the aisles, in the checkout, maybe for an hour or more, thus exposing any number of people. So I tell them to wear their masks and stay out of crowded indoor places.
Wear the mask properly.
Yes.
So we want to make sure the nose and the mouth is covered. It's not going to work if it's on your chin, if it's hanging off your ear, if it's on top of your head. So I think that's an important point. We can mandate masking, but proper use of masking is really the key. Yep.
Try to keep it on the face. You guys can see me correcting mine. Talking a lot drags it down.
Yes.
So it is very important, because anywhere air can enter, the virus can as well. Data on the Ohio Department of Health website shows number of positives from testing performed actually going down. Why are the numbers going up? So if you look at any of these websites and you start to study the numbers and you say, well, which of these actually means something? What does it mean? I've heard a lot of people say, well, of course we're getting more positives because we're testing 4 times as many people as we were 3 months ago. Of course there are more positives when you run more tests. And that's actually a valid point. However, when you look at a very specific measure, which is the fraction of the tests run that come back positive. When we started this 4 months ago, 3 months ago, and we ran our first 100, 200 tests here locally, Amy can remember that it was always very surprising to get a positive.
Mm-hmm.
So we had maybe 1 in 100, 1 in 150, then we got our second. And I would get a text every single time we got a positive.
Yep.
I would get a text, Amy would get a text, boop, it wouldn't tell me who, it just said we had another positive.
Yeah.
That was an extremely rare event, and I was always kind of shocked when I saw it.
Mm-hmm.
I think I even commented once that, my God, we've had like 20 negatives in a row. Is this thing not even here yet? Well, that's all changed. And what I'm referring to is now, I think even this morning I was in our system safety huddle, and I heard at least 4 or 5 different divisions report out a positive patient or family member experience. Somebody that had a positive test.
Yes.
A patient that was in the ED, a patient in labor and delivery. Now it is absolutely the norm and not the exception.
Right.
That these are coming back positive. So I'm sure you're seeing the same and hearing the same as I am.
Yeah, and hearing in safety huddle as well. You know, we used to have 20 pending tests, you know. Now I think today they reported out over 200 pending tests, you know. So we are testing more, but the percent of positive, when you do the math, it's still more positives. Yeah. Regardless.
The fraction of those tests that are coming back positive are going up very quickly. So, this is a great question. Do I need to wear a mask while outside, especially if I'm in a red level county? So, as I just said, the highest risk place for you all to be would be at a crowded indoor location. Lots of people indoors, no breeze, recirculated air. Yes, high risk. Now, outside. So if, let's say, you go out to a public park down at Yakutanchi and you want to take the kids on the swing sets or something, is that safer than being inside? It actually is. And we think that that's for probably 2 reasons. Number one, let's say there's a person in that park with you that's got coronavirus. He or she sneezes into the air. Outside, unless it's one of those just hot, windless days, most days that the wind will help immediately disperse and diffuse that, so that as you get foot by foot away from that person, the likelihood of you inhaling enough of a virus to get infected does go down. It doesn't go to 0, but it goes down compared to being inside. The second effect, which is probably quite profound, is the ultraviolet effects of the sun's rays. As you know, if you leave anything outside year over year in the summer season, within 2 years you go out and look at your lawn chair and it looks like it's 50 years old. That is because of the sun. It's not the rain, it's not anything else. Ultraviolet light is extremely damaging to things that are living tissue, and that includes the RNA of a virus. So that being said, yes, you need to wear a mask while outside, especially if you're in a crowded place. So if you're going to take a walk around your neighborhood with your dog and you don't anticipate, you're not at a park or anything like that, it's safe to go outside and walk around your park or walk around your neighborhood without a mask. Now, as if you guys are like my neighborhood, I don't get very far before people are coming out of their house and I'm talking to people. Next thing you know, there's a group of 5, and now you're getting a little bit in a closer danger zone even if you're outside. But yeah, if you want to go down and walk the flood wall and there's not people down there, you can do it safely without a mask. And I think that's probably at this point, we talk red level county or not. Ross County's down here 2 counties away from red level Columbus. I can tell you with the numbers, I don't care what county or color they designate our county, coronavirus is here. Don't wait for it to be designated red before you guys take this seriously and take action. So, Amy, do you agree?
Yeah, I totally agree. I think the next 2 weeks is going to be crucial for our communities to really be diligent with the masking, the distancing, cleaning, and hand hygiene. Because like you said, missing a party or something right now might make it in the future where I can see the birth of my new grandbaby, So we just got to be really stringent and keep up our efforts right now.
I was struck recently by the tale of a unfortunate fellow from Ohio. I think he was from Port Clinton, that went to one of the early opening parties up there around one of the lakes. Bunch of young people, and they, it was kind of sad. They profiled, timelined his social media posts, and he initially said, "This is BS. Can't make me wear a mask. I don't want to." And went to this party. Well, he gets it. And, you're reading his post as he's marching through his live. And it was like April 1st. He's like, darn it, I got symptoms and I got tested, and they told me I got coronavirus. And then he posts the next day and says, man, this is not small beans. He's like, I really feel crappy. And the next day he posts and says, I'm short of breath with even walking from my couch to the kitchen or go to the bathroom. And then 3 days later, the posting is that he'd passed at a hospital. And this guy was like 34. And so I know that it's not, 10% of people in their 30s getting it and dying. But this just struck me really how you don't know. So yeah, you might think, I'm 50 years old and don't smoke. I can go to that family reunion. But I think that what you said about, thinking about the parties in the future, the graduations in the future, the birth of your grandchildren, whatever, is really we have to take the long perspective on this.
Yes.
And go ahead and make those sacrifices now.
I agree.
I love this question. I think it's also a good one for Amy. How often should I change or clean my mask?
Well,
I'm guilty of this one.
I've heard. We've had some conservative measures within healthcare for the medical grade mask. So we have initiated CDC approved reuse and extended use measures. If you're out in the public and you have a cloth mask on, wash it whenever you think it needs washed, especially if it's hard to breathe through, get rid of it. If it's visibly soiled, get rid of it. If you've been somewhere where there's a lot of people around, any kind of coughing, lots of singing or shouting or anything like that, just wash it. So it's real easy. You just, with the fabric ones, you can just throw them right in your regular laundry.
Okay. Just watch the high heat on the elastic bands.
Yes.
That'll sometimes tear up an elastic band or render it less effective.
I guess that's a good point. So the integrity of the mask, not just if you can't breathe through it, if you cannot securely put it on your face, if it's not protecting you, then it's not doing any good.
So maybe air dry. Wash it in your washer, but then let it air dry outside, and that might work fine.
Yep.
This is a great question. This week we heard COVID-19 could be eliminated if we all wore a mask for 4 weeks. Is this true? Now you guys are asking Amy and I to get into a little speculation zone. If you guys remember, during the very first Living Well with Adena, myself, infectious disease specialist, I think Amy was there, the Ross County Health Department, I talked about maybe a not too easy, but a potential quick cure. And that would be, if you look at how a virus behaves, if at that first week when we start seeing the cases around the United States, if we had all said, all right, that's it, for 4 weeks, everyone's sheltering in place, only certain folks are allowed to go out, to go to a grocery store to get your food and your necessities, you had to mask up, we spread the hours out, basically made a maximal nationwide effort at shutting this thing down. Yes, we would have had whatever itty bitty bump there would have been. It would have delta down, changed down to almost nothing, and then yes, very likely would have went away. So obviously we didn't do that. What the nation did was a mixture of 50 different solutions to the same problem, where 50 states and the federal government did not give a mandate on exactly what everyone should do. So you had states like Ohio really did a great job, I think. That was a heck of a thing to live in my house like that for 2 or 3 months. Going out minimally, no eating out. My wife ordered the groceries from afar. We picked up, and it worked for Ohio because we did blunt that curve, right? We weren't New York or Manhattan or some of the other states like Michigan that really got hit hard. And then we also see the consequences of then pulling the trigger on opening too early. So that I don't digress too much, I do believe that the answer to this question is that yes, that if nationwide we were to all be this aggressive for 4 weeks, we could shut this thing down completely. unfortunately, from what I've witnessed nationwide and even at a state level, we're fighting this pandemic 50 different ways, and in Ohio, 80 different counties without a unified response. And this is the equivalent of 25 people being in this room right now and 25 opinions on how best to prevent infection. Amy and I might be wearing a mask and washing our hands, but the rest, some of the other people, like, this is BS, I'm not wearing a mask. So that throws Amy and I right into the pool then of all the other risk. So everybody working hard to do it right, the efforts are for naught, and they suffer the same consequences. So that's a great question. Maria's got anything more for us? Trying to keep an eye on the clock. With the current surge, is Adena planning to reverse any of its opening efforts, visitation, number of people on the inside? Very good timing on this question, and the answer is absolutely yes. I waited until I got 24 hours of feedback from our medical group, from the leadership here at Adena, from infection prevention. I also waited for the governor's address last night to see what he was going to say. And after having done that, I made the decision this morning that we are going to return to a no visitation policy at Adena as of Monday at 8 a.m. There will be exceptions granted for those patients who are at the end of their lives. We certainly want their family to be with them if that is the case. For those folks who are disabled and need assistance through their stay, we will certainly make an exception. For those of you having major surgery, we know that that's very scary and challenging, so we will grant a single exception for that. And then, of course, for minors, I know how terrifying that would be to drop my kid off at a healthcare system and not know what was going on. So for minors, we will allow an exception. That'll generally be a single visitor exception. You'll be expected to go through our screening processes, your temperature check, you'll be asked questions. Through the course of your stay, you'll be asked to wear a mask the entire time that you're here on campus. So no other major changes beyond that, but I think that is the big one because I know how important it is when people are sick to want to visit them and support them and know what's going on. So I ask the community for your understanding. I plan on looking at this on a 4-week rolling basis. So starting Monday for 4 weeks, we're going to have significant visitation restrictions until I can be convinced that the second wave of the surge is almost over, and then certainly if it's safe, return back to less restriction. I think I hear Maria's pen working over there. Thank you very much. Face mask locations available, at rosscountyhealth.org. rosscountyhealth.org. So you can access all of those face mask locations that I read off from the flyer there as well. Our website is a good resource. The County Department of Health actually love their website, Ross County Department of Health. Certainly the state of Ohio. If you really are kind of a data geek like me, I get a lot of my information and trends from Worldometer, WORLDOMETER.com. You click on coronavirus, and then you're showing the picture of the world, not the picture, but all the places. Click on USA. You can look at USA's numbers. You can look at the numbers in any state, the daily number of cases, the daily number of deaths, and then there are 3 buttons for 3-day averaging and 7-day averaging, which it visually makes it a little bit more easy to interpret directionality and where we're going. So that's one of my favorite sites. And then, of course, the state's Department of Health website. So, all right, Amy, let's see. She gets that one.
Okay.
Ray is the conductor.
Yeah, so again, just can't stress enough how important it is to mask anytime you're in public, anytime you're not with your household, and to wear your mask properly over your nose and your mouth, and it's secure. Social distancing, at least 6 feet away from people at any time that you can, is very important. Just be mindful of that, especially when you're in the grocery store. I was there yesterday and I heard it overhead saying 2 cart lengths away. I was like, oh, that's a good way to remember that I'm 6 feet away. So just different things like that. Hand washing, 20 seconds with alcohol-based hand rub or soap and water. Make sure you cover all the surfaces of your hands, in between your fingers, your palms, your tips, all of that good stuff. So those are just, and then enhanced cleaning as well. So as I mentioned earlier, if you don't wear a mask and you sneeze or something like that, those aerosols or droplets could go onto surfaces and contaminate them in that way. If you touch that surface and then touch your eyes, nose, mouth, anything like that, all those things that we do and we don't realize that we do throughout the day, you could possibly contaminate yourself that way too. So make sure you're cleaning with a disinfectant that's approved by EPA for coronavirus, and there's a lot of them out there.
Almost anything with Clorox in it works really well. The Lysol products.
Lysol, all
those
of
are
those
brand
things.
names you can go to.
It's still really hard to find the wipes.
Yeah.
So I look every time I go, but it's really hard and it's limited to one.
If you're careful with it, even a 5% Clorox solution can be made. My mom used to do that instead of spending all the money on the wipes.
Yeah.
And that works. Just don't get it on your clothes, and don't mix it with detergent, because that could be dangerous if mixed. So.
I think it's a 1 to 10 solution, but
1 to 10, okay,
CDC gives all of those recommendations on how to mix those and how to use that. So.
All right, I think we're reaching the end. I want to thank Amy for joining me today. This is always very interesting when we do these. I'd like to thank everybody here for putting this together for us, and most importantly, I'd like to thank you guys in the audience that took your time out today to join us. So until next time, thank you very much. Please stay well.
Thanks, everybody.
There we go.